Welcome to All Things Public Health with Alvin Kapitako. On this show, we bring you expert interviews, discussions, and stories about public health. Join us as we explore public health topics that are of interest to you, our esteemed listener.
Welcome to the All Things Public Health podcast with me, Alvin Kapitako. My guest is Celia Kaunatjike, who is the Health Promotion and Social Determinants Officer with the World Health Organization, Namibia. She's also very actively involved in the work around addressing gender-based violence, and today she will be talking to us about gender-based violence and why it is a public health problem. Thank you for joining me, Celia. Please feel welcome. And please tell me about the work that you do.
Thank you, Alvin, for having me. The work that we do in WHO on gender-based violence and intimate partner violence is guided by the WHO Global Plan of Action to strengthen the role of the health system within a national multi-sectoral response to address both interpersonal violence, specifically focusing on women and girls, and also against children. We work collaboratively with the Ministry of Health and Social Services, and through that partnership, we have adopted a global handbook. There's a handbook specifically looking at the clinical management of survivors subjected to intimate partner violence and sexual violence. So as a country working together with the Ministry of Health and other partners, we adapted this handbook to the Namibian context. And we then used the handbook, one, to train health workers, for them to understand the complexity of gender-based violence, and also to support them in providing a more comprehensive and quality care for survivors of gender-based violence who may enter the health facilities. Maybe they may not necessarily disclose abuse, but they may come for other ailments, but could be victims of gender-based violence. So as a clinicians, what are the clinical cues that may actually say, that may give you an suspicion that this person might be subjected to intimate partner violence. So the training is about that. So we use it as an entry point to reorient the health system, to look at a survivor of gender-based violence, not only in terms of the forensics that they need to collect, but as a patient that needs a comprehensive, holistic care. So in terms of medical care, physical care, in terms of psychosocial support, in terms of mental health care, that they sort of accept this patient as any other patient, and not necessarily like when there is a police involved. So that's actually what we've been doing. We train all the regions, not all facilities, but at least we have trained trainers in all the regions, and we keep on cascading to the different parts of the country. So that's in terms of what we do as WHO with the Ministry of Health. But obviously there is more work being done in that area.
How many health workers have you trained so far?
I think it's over 400 since the rollout. I don't have the exact figure now because the additional training that were done this year as well. But it's around 400 health workers that were trained. When I say health workers, it's literally medical officers, nurses, and social workers. At times we'll have people from other ministries joining, but primarily these three cadres.
Sorry, I might have missed it. You said this was started in what year?
The adaptation process started in 2016, but the training may be effectively since the past, just before COVID, since 2019. Extensively, was affected a bit by COVID, and then we resumed after the 2 years of the COVID pandemic, but definitely we started in 2019 with the actual training of health workers.
Okay. And it's across the 14 regions in Namibia?
Yes.
Okay. So the next question is, if you could just sort of explain what the difference is between gender-based violence, which is GBV, and intimate partner violence, please.
Okay, gender-based violence is an umbrella term for any harmful act that is perpetrated against a person's will. And this is based on socially ascribed, specifically gender differences between males and females. So gender-based violence highlights the gender dimensions of this type of acts, or in other words, relationship between female subordinate status in a society and their increased vulnerability to violence. So gender-based violence itself can be either sexual, physical, psychological, or economic in nature, and may also include acts of attempted or threats or committed with force, manipulation or coercion, and without the informed consent of the survivor. So when it comes to intimate partner violence, literally it refers to an ongoing or past violence and abuse by an intimate partner or an ex-partner. So this could be a husband, a boyfriend, a lover, or whether it's in the current or past tense. So, and this also, refer to, it could either also be physical, violence, sexual violence, emotional, psychological violence, but also include controlling behaviors, stalking the client, the person. And I think within the Namibian context, we can refer to domestic violence or abuse or family violence. So, our domestic violence act really is based on the relationship, it's sort of intimate partner violence because it's based within the relationship between the household and so on. So within a particular household, so that is you can say it's intimate partner violence. It's intimate partner violence is part of gender-based violence, but it's specifically focused between two people who had a romantic relationship, whether current or in the past. So I'm not so sure whether that clarifies.
Yeah, no, thank you for clarifying that. It's actually very clear. So, I am also interested to find out, like, the gender-based violence situation in the country. From your observation and also the work that you do, media reports and so forth, do you see an increase or a decrease, let's say, in the last 5 years?
Well, I think it's difficult to say whether there's an increase or decrease because gender-based violence is underreported. The latest statistics that we have that were population-based kind of surveys were in 2013 from the National Demographic Health Survey. But generally, the prevalences are high. 1 in 3 women between the ages of 15 to 49 reported having experienced some form of gender-based violence, whether it's physical, sexual, or emotional. And some of these actually start as early as, the statistics refers to 15 years, but actually in certain instances, it even starts at conception. If you look at the statistics, not just in Namibia, a lot of women report abuse during the time of pregnancy, where the woman will be hit on the stomach, by the partner, and so it starts extremely early, and it sometimes it lasts a lifetime for some women. The statistics that we have says refers to 15 years, and sometimes into your 60s and 70s, women still experience abuse at the hands of their partners. So, just to go back to the demographic health survey, it says that 32% of women aged between 15 and 49 have experienced violence. That makes it 1 in 4 women. 6% of these women reported experiencing violence during pregnancy. And then 15% of Namibian women who experience violence, they never sought help. And if they do, for the most part, it will be the health system. And then also, the level of tolerance against violence is actually, I think it's one of the contributing factors. 28%, for example, 28% of women and 22% of men believe that it is justified for a husband to beat his wife for one or other reason, whether she didn't cook, whether she denied him sexual pleasure, whatever the case might be. But there's high tolerance of violence against women.
What are the contributing factors or the causes of gender-based violence as well as intimate partner violence?
We can list a number of issues, but the key driver for gender-based violence is really unequal power relations, or the unequal power balance between men and women within a society. And because we are coming from a patriarchal society where men are regarded as the head of the household, they are the providers, so we have this notion that like women are the weaker or the lesser member of society. So that subservient, that power imbalance increases the vulnerability of women to violence. So we can then maybe add the other dimensions to violence that relates maybe to alcohol or to economic, to stress and depression and all kinds of other things. But really that the power imbalance within our society perpetrates or drives the high prevalence of violence within our society. If you look at statistics, women are also disproportionately affected by by gender-based violence, women and girls. So that then just serves to support the notion that the differential power within society between men and women drives or is the key driver of gender-based violence.
You said that gender-based violence is underreported. And then you also just mentioned now that women are the ones who are mostly affected. I mean, we all know that men also experience forms of gender-based violence. So what I wanted to find out is, why is it that men do not come out? Because we see now a high number of suicide amongst men specifically.
I think, as I said, men and women have, because of these power dynamics, men and women have different risk of participating in or being victimized by violent behavior, especially in a home. And women are disproportionately affected. But the Namibian laws, when it comes to addressing issues related to gender-based violence, are gender neutral. And the provisions within those legislative framework are actually, it's the same for men and women. So whether you are men or women who report a case of violence, of domestic violence, those provisions would protect you as well. So if a man is experiencing violence from a partner or, they can approach the police, they can go to a social worker for support. But I'm not saying that in the ignorance of the kind of attitudes that people have when a man experiences violence. So they would still need to do a lot in terms of sensitizing society, but also in terms of capacitating our service providers to actually provide a non-discriminatory service to women and men who may be subjected to intimate partner violence. So I think this is key, because we do find men who experience violence at the hands of their partners, and the law, literally the provisions are gender neutral. It's not like it supports women more than men, as the notion is, but we do need to work on our attitudes when it comes to these things, so that those services are easily accessible to men as well when they need them. And Alvin, you referred to the issue of suicide and why it's high in men. I'd really like to pause on that question, because I think we are at a very critical time in the year where it's Christmas, and you see I'm not so sure why, but you see higher reports of either attempted or actual suicides. So and I think it's a very important question. And it's always unfair to sort of generalize when it comes to why more men were not, as opposed to women. But maybe we can refer to some possibilities that might explain why men are struggling emotionally. One is the whole issue of societal roles. I think we put a lot of pressure on men to man up. The concept of masculinity. Men are encouraged to be tough. And then any admittance that they are not okay mentally or they're struggling emotionally may be seen as a sign of weakness. That's one. And while as us as women, the way we are trained or the way we are socialized, it's you can express your feelings. You can cry anytime. You can approach somebody when you need help. So men are not encouraged to speak up, and through childhood they are taught not to cry. Boys don't cry or men don't cry. So this really affects how we manage emotions. We manage our our mental health. So the issue of gender roles kind of also maintain a stigma around mental health, leaving men unable to discuss either their true feelings when they are struggling, and also to seek professional support and treatment. So this is really this is concerning. As I said, as women, we can speak. You can go to a friend. You can go to maybe to your pastor or religious leader. You can go to a professional easily when you're experiencing something, when you are struggling emotionally, and it's not the case for men. So they sort of internalize, they try to deal with these issues themselves where they actually need professional support. That's one. And just in addition to that, the use of alcohol in relation to depression or stress. You know, like somebody said, alcohol and depression are intrinsically linked. So somebody might resort to alcohol and drink excessively in order to deal with the discomfort, you know, of what they're experiencing. But the issue with alcohol is that it as much as it can probably relieve or bring calmness temporarily, it is also a depressant. And over time, the symptoms just becomes worse. So we need to educate our men. I think there was a conference during the World Mental Health Day. It was a conference that I truly appreciated. I think it was in the North, where it was focused specifically on men addressing the issues of men being able to speak up, addressing the mental health issues in men. We need more of those. We need to bring the discourse in the public, in the media, in our communities, in our households, that it is okay not to be okay, even when you are a man, and actually create avenues where men can easily go to and speak to. You know, there's a kind of thing in Zim where they have in the community, they have what they refer to as, is it the neighborhood, the friendship benches, where in a community you trained people to at least provide some form of a first line support to somebody who's struggling emotionally. So if we have...
And you said that is in Zimbabwe?
I think it's in Zim. I think that concept started in Zim. Maybe it's expanded to other countries now. If we can have something similar and say we create some form of a buddy system for men, where we train a number of men as peer supporters for their counterparts who may experience, either difficulties in coping with the pressures at work, maybe with financial struggles, with, maybe problems at home, and they can just have somebody that they can reach out to in a safe space, to address some of these, emotional difficulties or the stress that they may be experiencing, because we have to create those avenues. And as I said, that the conference that was in the North, I think it's something that has to continue, and we need to create more of those platforms where people can discuss and make it, and sort of just change the narrative that men cannot be weak, a man cannot show his emotion, a man cannot cry, a man cannot, we need to break these masculine notions around what men can and cannot do, and encouragement to seek help when they need the support, instead of resorting to violence, to alcohol, to all these things that then actually increases the vulnerability to suicide and so on.
So we had the conference in the North that you just mentioned, which was the men conference, right?
Yeah.
And then you also mentioned that health professionals, medical doctors, nurses, and social workers are trained to sort of pick up signs of abuse when people visit health facilities. So I just want to find out, what other interventions are sort of in place to address gender-based violence, and also how we can improve on this situation.
I mean, we start with the legal framework. We have a good policy and legal framework that addresses gender-based violence in all its forms. We have the gender-based violence protection units that are under the police, but it's a multi-sectoral unit that also house social workers. They are in every region. They are not in every town like the police office, like the police stations, but they are there. And then also I think there are other services that the Ministry of Gender provides, the Ministry of Health and Social Services provides. But the first point of contact, I think, if you are struggling, if maybe you're experiencing gender-based violence, whether you're a man or a woman, I think the best is to first approach maybe the social worker's office, because they're also everywhere, and just have somebody to provide you with counseling, with support, and also introduce you to more professional support. Because social workers work with the police, they work with the medical doctors, they work with the nurses. So, but if it's a case that requires medical care, you go to a clinic, and most of the nurses are trained in this regard. They can also provide the appropriate service and then refer you also to further support. But we should not keep some of these things. We are trained that you should not speak outside the house. But violence committed against someone even within a household, we have seen the devastating effect of this, where you don't want to carry somebody in a body bag.
Yeah.
So we need to break the cycle of violence by speaking out, by seeking the appropriate support and care.
My next question was going to be, there's all these interventions in place, but why does it seem like gender-based violence is still increasing?
As I said at the beginning, that the tolerance towards violence against women specifically is really high. To the extent that if you find out that a husband and a wife are arguing next door, as a neighbor, you may not want to intervene because it has nothing to do with you. So if it becomes violent, you may still be quiet. And for some women, you hear them saying that their approach may be an aunt or an elder in the family, and they were sent back to the same household. So we definitely need to address our social norms and values around women, their worth, and actually address the issues of violence. Unless we change these societal norms, it will continue to increase in the secrecy of the homes unless it becomes these severe cases that makes it to the headlines. But it's not, if a case makes it to the headlines, you should know that there have been multiple counts of episodes of violence within that particular relationship. So as a society, we really do need to have this sense of intolerance against violence, because you can resolve a difference without becoming violent. And if you need help within your relationship, seek help. I think we do have a good number of social workers within the country, and I think government has tried to ensure that this service is available even in the periphery. So it's not just in urban centers. So we need to imbibe the culture of seeking help, of reaching out. You know what I mean? So that needs to change. Otherwise we keep on, addressing the manifestation of the problem without addressing the root cause.
Why is gender-based violence and intimate partner violence a public health problem?
Well, the magnitude, as I said, the magnitude is high. 1 in 3 women experiencing violence, it's quite high. So definitely, it is a public health concern, and the effect on someone's health. If you look at the statistics, women who experience gender-based violence are more likely to have issues related to their mental health. They can actually resort to alcohol, which has a number of health effects on themselves. It affects their issues. They are more prone to suicide ideation or thoughts of suicide. And also, it also affects their reproductive health, sexual and reproductive health, needs. There are a myriad of health problems that emanates from gender-based violence. So definitely it's a concern for public health, and we need to address it because 1 in 3 women, and if you look at the impact of this, the legal framework is there. We're trying to train the institutional arrangement is there. We're trying to train the health workers and the professionals involved in gender-based violence to respond better. You know what I mean? And also there are interventions from other UN agencies with the Ministry of Gender that relates to societal norms and values, but this takes time to change. But we keep on, pushing that eventually our society sees the value of women differently, But the magnitude is worrying. If you count 5 people, you should know maybe 1 or 2 or 3 people 2 of those people may have been subjected to intimate partner violence, which is extremely high.
Yeah, it is quite high. And what is your message to our listeners?
My message to the listeners is that prevention of gender-based violence is everyone's business. Let's not turn a blind eye when we see that there is potential risk. If there's really violence, inform the authorities that people can come and investigate. But if you may be experiencing gender-based violence, reach out for support, for care. A lot of these things are done in confidentiality, with respect for your wishes and privacy. And so you need to trust the system because they are there to help you. So reach out for support, reach out for help.
Yeah, so that was Celia Kaunatjike from the World Health Organization Namibia office. Thank you so very much for taking the time to listen to this episode. Bye-bye.
Thank you for listening to All Things Public Health with Alvin Kapitako. If you enjoyed this episode, please share it with others, post about it on social media, or leave a rating and review on Spotify, Podbean, and other podcast platforms. Also, follow us on social media at All Things Public Health Podcast to engage with us.